Okay, done.
Yeah. Welcome once again to the MindSmith Mental Health Awareness Series. Today, our guest is probably India's topmost authority in mental health and law. He is the professor and the head of forensic psychiatry at NIMHANS, Bangalore. He is also the head of the telemedicine center in Bangalore, as well as he has completed a PhD in law from National Law School, one of the go-to people for all legal issues in Indian psychiatry. Please welcome Dr. Suresh Bada Math from Bangalore. Welcome, Doctor.
Good evening. Good evening.
How are
Good
you
evening,
doing?
everyone. I'm fine, Satyen.
I forgot to mention that he is also an avid scuba diver. One of the rare hobbies which I really admire in him, and I'm very jealous of it. Someday you have to teach me that.
Sure.
So, Dr. Suresh, the reason why I wanted you to come on this particular talk today is because of an experience which I had recently with a patient, which I'm sure a lot of families and a lot of psychiatrists who are practicing in India, they will, resonate with. They must have seen something very similar. So this particular patient, a 40-year-old male, I was called for a home visit because he had simply refused to come and see a psychiatrist, although he had a history of visiting psychiatrists regularly. But this time he was refusing to meet any doctor. He had shut himself off into a room and he was constantly drinking, smoking, using certain illicit substances also, which the family wasn't very sure about what all he was doing. But his behavior became very aggressive. He would not listen to anybody. He would run out of the house if confronted. He would drive away, disappear for a couple of days, and then again come back and demand money. He had also made some very rash business decisions. And his behavior was such that the family was scared to talk to him. He had even hit his parents once. So when I was called, the issue which I was confronted with, and which we of course would diagnose at probably a manic episode with substance abuse. But the question was that if the patient is now refusing to take medicine, refusing to see a doctor, what are the legal options left to the family to manage this kind of a patient?
Okay, Dr. Satya, it's like this. One is a legal answer, another one is clinical one. Let's first answer legally. Legally, if a person with mental illness, legal is basically Mental Health Care Act of 2017. Usme it says that section 100, which talks about the duty of the police officer in the area, in the jurisdiction. So they talk about in section 100, they say that if a person with mental illness found wandering at large in the area of the police station of the jurisdiction, the station officer will take the person into his custody. That is one, wandering at large, or a person with mental illness who is harmful to self or others. So in such a scenario, there is a duty of the police officer to take him into his custody. Custody in the sense, he has to take the person and produce him in front of a public mental health establishment. Unfortunately, the word is public, so police will not take him to a private because the law is like that. That is the reason I'm telling you, legally, the answer is legal answer. So they will take him and that mental health establishment, so-called public mental health establishment, that means a government mental health establishment. The doctor who is in charge of that establishment has a responsibility to do the evaluation of that person. That means police has to come to his house, take them into their custody and produce him in front of a mental health establishment, which is a government one, and the government doctor who is in charge there has a responsibility to assess him and see whether he has mental illness to that severity that he needs to be admitted. So then the doctor will decide, will he be admitted under section 89, that is admission of a person with mental illness for less than 30 days. That is section 89. But if the doctor finds that he does not have any mental illness, it is just a drug abuse or alcohol use, and he feels that he doesn't require admission, he will tell the police that he doesn't require admission, Or else, if he doesn't have mental illness, he will say he doesn't have mental illness and he has capacity, so you'll be allowed to walk away. So this is the legal answer. Okay, this is how if you follow legally. But unfortunately, what happens is, if we approach police, already the police is overworked. They are looking into crime, or it may be very difficult for a family member to go to a police. The reason being is stigma, already a stigma of mental illness. Police coming to their house in the jeep, and invariably they do not know, they are not been educated about mentally ill person. The way they take them into custody, they may chain him, all those things may happen. For that, many family members do not want to inform the police. In such a scenario, what to do? So now the clinical answers will come. The clinical answer, imagine, is an old patient and a new patient. If it is an old patient, like Dr. Satyan, you are treating him and you know the family very well, you know his diagnosis, you know his substance use is there, alcohol use is there, he is also has bipolar affective disorder, he has mania, and you have his file, everything, you know you have admitted him, you know the family whereabouts, his diagnosis, everything. Then you can send your ambulance from your hospital. If you have those, like many places like Delhi, Bangalore, they have some of the hospitals have these facilities where they send the ambulance along with their nurse and also the ward boys who have been trained to bring those patients to the hospital, because you know the family, everything, family trusts you. That kind of services can be taken. So there, the things of going to the police, all those things do not happen. Here, the doctor trusts the family and the family also trusts the doctor. So this is very easy. If it is a new patient, which you don't know anything about that, there the tricky situation comes in, where the family doesn't know the doctor and the doctor does not know the family or the patient. These are the gray area where should we take a risk? I don't know. Should we go ahead and take the person into custody, bring him to the mental health establishment? Then there are a lot of legal issues will be involved, because you are a private establishment. And imagine, because the law says that under Section 100, to take him to public mental health establishment. Even the families may know the police, but they do not want him to take him to a government hospital. So legally, then it becomes an issue. Because the police has a responsibility under the law to take him to the government hospital, but the law says that. So in such a scenario, the law needs to be amended, telling that whichever mental health establishment, if they're comfortable going to a private or semi-private, something like that. So that is the answer, if you ask me. So if it is an old patient, you can go ahead. It's ultimately it boils down between the trust between the family member and the doctor or the establishment, or else take the help of the police. And many a time, many state, the police have not been educated. In some of the states, they have done a very good education about the mental health to the police, and the police cooperate. And again, it depends upon the police station. Some of the police inspector or a station house officers, they are very good. They are very sensitized. They do it. But however, these are all, it's depending upon the police officer. That's what I would like to say to you, Dr. Satyan.
Right. That's a great answer, sir. I'm sure that a lot of people will benefit from the insights you have given us on. And when it comes to the issue of law, I think many a times when I try to see examples in international law also, I believe that the very concept of insight, that a person's ability to understand that their own behavior might be damaging to themselves or to others, or the extent of the illness they're suffering from might be impaired. That can happen in case of personality disorders, that can happen in cases of any psychotic illness, that can happen in a severe mood disorder manic phase. So how do you approach the idea of insight and the law? That has been a curious question for me.
Okay, see, insight and law, let me be very frank. Insight doesn't come into picture in law. Because insight, it says that imagine if I'm having alcohol, I'm taking alcohol more than what I'm supposed to take. The people, if the family members say you're taking too much, but I say I'm taking less. My wife may say I'm taking 2 quarters, I will say maybe half a quarter, not more than 1 peg, I will say. So in such a scenario, I may not have the insight, or else my wife may be exaggerating. I may be taking 1 quarter and she may be telling 2 quarters. So in that way, it becomes very difficult. Insight parameter does not picture into mental health law either in India or in many of the countries. It is the severity of the illness which plays a role. Right. So regarding alcohol, I told you, if you take even some of the illnesses, though they know I am suffering, like you can take obsessive compulsive disorder, they may have repeated thoughts. They say, yeah, I may have some repeated thoughts, but I don't agree that I'm mentally ill. Right. So in such a scenario, they may give a model. I may be, because of exam stress, I may have recently I had a family problem, or else my family member died. So it is a stress. I don't believe I have mental illness. So the insight is absent. As per the medical definition of insight, it is absent. But I'm attributing to the stress or an environmental stress. Hence, legally, the insight does not correlate directly to it. But however, instead of insight, the law comes up with a very important point under Section 4 of Mental Health Care Act, something called as capacity to consent. Right. Here it is called as mental capacity. That means if I give a consent for certain procedure, it may be for surgery, it may be transferring my property to somebody. So their capacity to consent, the capacity here, mental capacity means, do I have that mental faculty to say, yes, what I'm doing, I have understanding. I know what contract I'm entering into it. I know the consequences of the contract. I know if I don't take decision, what will happen. So that if I'm able to understand, that means the person has mental capacity. Whether he has mental illness or not, it does immaterial, and he can enter into the contract. So the answer for your insight does not play a role, especially in Mental Health Care Act legally. And here the issue comes is capacity to consent. As per the law, there are three important criteria. One is comprehending the information, what they know. If somebody says, the doctor says, Mr. So-and-so, you have mental illness, whether I understand what the doctor is saying, whether I'm able to appreciate what the doctor is saying, that is comprehension. Second one is understanding the information and weighing the risk. Like suppose you say to a patient, see, if you are suffering from this illness, something called as alcohol dependence or alcohol addiction, along with you have mania, that example which you gave. In such a scenario, if you don't take treatment, A, B, C, D will happen. If you take treatment, E, F, G, H will happen. So as a doctor, I will suggest you choose this. So the patient will go through the information and he will decide which is best for him. So then if he gives the information and he says, Doctor, sir, I know that I have this problem, but I want to take a treatment somewhere else. It may be any other treatment. It may be just a counseling. It may go into Ayurveda, or it may go into allopathy, or it may go to ECT, electroconvulsive therapy, or I would like to take injection. It is if the patient has the capacity, he will decide what he is going to do, and he has to communicate that decision. That is the third point. If he's able to that means he has capacity, and no illness, whether he's suffering from an illness, he does not have an illness, does not come into picture. That's what the law says. Capacity to consent plays a role more than the insight, Dr. Satyen.
Right, sir. Thank you so much. And, taking again the topic of today's discussion being, the uncooperative patient, right? And in psychiatry, we do unfortunately meet lots of patients who do not cooperate with the treatment choices. And one of those most common frustrations for quite a few doctors, especially with patients who will need long-term therapies, long-term medication, is when the patient knows the consequences, but then refuses to take medicine regularly. And many a times they attribute it to forgetfulness or a lack of willingness to take the medicine. So at this time, I think it's more useful if we talk about the clinical options which are available to that patient and to the families in case of a patient with, say, psychosis who refuses to take medicines.
Okay, Satyen, you have brought a very important point. See, the law which has been enacted, Mental Health Care Act of 2017, it talks very clearly in the preamble. This law is made for two important reasons: is to provide mental health services. Okay. Second one is During the provision of mental health services, we need to uphold the rights of the persons with mental illness.
Yes.
So we should not violate the rights of the persons with mental illness at any cost. If he has capacity and he is able to decide, he will choose whether he has to take treatment or not. And under no circumstances, doctor can force treatment on the patient. So this is a very beautiful law. My concern is more than the doctors. I'm worried about the caregivers, the family members.
Yes.
Imagine the person had 2-3 episodes and you have given the treatment. He is now fine. You know he will relapse. By at least you can tell the risk. There is high chances of relapse. But the patient says, no, now I am better. If the relapse comes, I will decide. Right. Family says, please give him treatment. But he has capacity. He is not in the episode. He will decide as per the law. Because neither the family can force him, nor you can force him. The law will come into picture to treat him against his wish and will when he loses capacity because of the mental illness. So this is unfortunately a situation where should we override his liberty is the question. But the Constitution is very clear. If a person has capacity, he can decide on his wish and will, and nobody else can decide on his behalf. Either the doctor or the family member. Individual liberty prevails. This is the law even in UK, even in US. But however, the way you have pointed out, there is some provisions have been given in US and also in United States of Kingdom, where they say if a person has multiple episodes, like mania, he had around 7 to 10 episodes, or maybe schizophrenia, around 4 to 5 severe episodes. During the episode, he becomes very violent and he has beaten up many people. And some people who have been beaten up had to take medical support. That means they required health support. And he has got into conflict with the law because he has become so violent. In such a scenario, in UK and also in US, there is something called as community treatment order. Also, it is called as compulsory treatment order. Right. There, the law comes into picture and it will be an independent evaluation done by the doctor's previous records based upon his past history of mental illness, based upon his severity of every time which occurs. And every time whenever there is an episode, he has become violent and he has harmed himself or others to such an extent, they also required care and the patient also required care and he required involuntary admission in each time. In such a scenario, a community treatment order will be given by the court, right, by the judiciary. Now, the order when it is given, in certain states it is different. Like in US, they say, when the order is given, a mental health professional can go to his house and give injection against his wish and will. That is one type of order. Right. In UK, the order is there. If he doesn't take treatment, he can be brought back to the hospital. You can't give treatment in the community, but he can be readmitted into the hospital, whether he is ill or not, for a treatment purpose. So that is in certain states have been given. So in India, this is not far. Some family members who suffer will go to the court and say, I'm the one who am looking after him. And with the difficulty, I spend all money. I go to the hospital. I treat him. He becomes all right within 3 to 6 months. And he stops medicine because the doctor says, I can't do anything. He has capacity. The law prevents me to give him treatment. Please help me. The court, especially in India, may be in favor of collective rights, that is family rights. One is individual rights, another one is family rights. So when they take this consideration, the court may say, let's take the board's opinion. And the court may say, please go ahead and give treatment because he requires treatment. So such scenario may not be far. It is left to the persons with mental illness, family members approaching the court. I am least bothered about the doctors. Let me be very frank with you, Dr. Satyen, because for you, it is one of the patient. He does not come. That's it. For the family member, it is a lifelong, that duration. Imagine he has a relapse, 6 months to 1 year. 1 year is deleted from the patient's life and also from the family member's life. They have to go through that hell. So for them, it is a nightmare. So I am speaking on behalf of the person, from the family members of persons with mental illness. And I think there are many family members association nowadays, at least few of them I can name them, but they can approach the court and ask for such an order.
Right.
And though there is no provision in the current Mental Health Care Act, it is a family member's proactiveness to go and request for that, and that can be done because it is there in even in Australia, in some of the states. In developed country, it is there. It is not far. It may come into India. I hope that it may come. It may help the family members of persons with mental illness. Over to you. But again, this has some positiveness, some negativeness. Many persons with mental illness criticize this order, but family members find it very important order that they are empowered so that they can take them to the hospital. Many caregiver, many family hospitals says that, sir, if that order is there, we can go and give treatment. But anyhow, it's a balance between the individual rights versus
and
the family rights.
Collective
family rights.
Absolutely.
Okay,
and
Dr.
that I think reminds me of this unique feature which has been given in the Mental Health Care Act 2017, which is of advanced directives. That is an interesting thing. I would really want you to give us a couple of minutes of this particular clause of advanced directives and how it can be used for the patients and the family's benefit.
Yeah, excellent, Satyen. It's again a very, very positive step. The Indian Mental Health Care Act 2017 says many of the legislation from developed countries do not have this advanced directive. Advanced directive is basically writing a will. Any person who is an adult, okay, whether he had mental illness in the past or not, who has capacity, can execute a will telling that if I get mental illness, how I should be treated and how I should not be treated. That is one important point. And he can nominate somebody's name. If I am mentally ill, either my dad will take decision, or my mother will take decision, or my wife will take decision, or I can write somebody who can accept, like a doctor so-and-so will take the decision on my behalf. That's well. But those people need to accept, yes, I will take the responsibility of giving consent when he is severely ill. So that is advanced directive, and this advanced directive is done on a plain paper. Now the regulations are there, how to do it, it is there. That has to be done, and it will be registered in the Mental Health Review Board. Unfortunately, these mental health review boards have been done in few places, in few states. Some states have not been done. In some states, some states in India has been done, and some of them are working well, some of them are not working well. Some of them have started registering advanced directive. But as per the current Mental Health Care Act of 2017, it has to be registered free of cost.
Right.
And he can write, and whenever the person is that in a situation, he can write this, and those people, imagine if I write an advanced directive and register it, if I become ill, so-and-so doctor will treat in such a hospital, and such a medicine will be given, and so-and-so person, I'll name them and they will take the decision on behalf of. That is an advanced directive given by a person, like before in hand. Writing a will is an excellent provision given in Mental Health Care Act of 2017. Yes, it will be used by many of the educated people so that they can exercise their choice before they get an illness. Like I write my property, in case of my death, so-and-so person will be hiring it. Similarly, here you can write it, and it's one of the best feature of our Mental Health Care Act of 2017. Many of the country do not have it, and India has this.
Yes, that's a great advancement. I'm very impressed with this feature of the Mental Health Care Act. And now, when we are talking about law, there is another law which also has an overlap for mental health issues. It's the Persons with Disability Act, right? And what I need to ask you, Dr. Suresh, is that is there a provision in the PWD Act or in the MHCA Act which provides for some kind of a financial relief from the government side to the families for the upkeep of such patients who have chronic mental health issues, and they have got the proper grading and the proper percentage of disability, everything certification done? What kind of provisions exist for them?
Okay. Dr. Satyen, it comes under Right to Persons with Disability Act of 2016, and already this act has been implemented. Rules have been notified. Guidelines for evaluation of mental illness has been clearly mentioned. That is IDEAS, that is Indian Disability Evaluation Scale is there. And if a person with suffering from mental illness can approach the government doctor, and he will get the disability certificate percentage. By default, it is a temporary disability certificate is given. That means any person with mental illness who comes to me a first time or second time, invariably it will be the temporary disability certificate. The temporary is basically telling that, yes, I have seen him, he has this is the percentage. And I can write it for 1 year. By default, it is for 5 years. That is the disability certificate is given. Suppose if he is under treatment with a psychiatrist for more than 5 to 10 years or 20 years, and I know this illness is not going to get cured, then the psychiatrist has been given a power to tell that it is a permanent disability. It is based upon the duration of treatment, response to treatment, whether the person is taking treatment or not. All the criteria will be taken into consideration by the treating psychiatrist, and he will say it is permanent. And now, once he says permanent, that disability certificate has to be recognized by the authority. So that authority is notified in each state, like it can be a medical college, it can be a district hospital. So how to approach this, sir? Then for this, in 2021, the government of India has notified something called as swalamban.gov.in. Here, it is called as Unique Disability ID, UDID card. If you type UDID card in the Google, you will get this first link called as swalamban.gov.in. You have to go and register there, keep your Aadhaar card with you, mention their address, and say, these are the certificates I have, this is the mental illness certificate I have, I've been on treatment, please give me disability certificate. You can apply for that. And when you apply that, it will say, go to the nearest hospital, whatever they will give the address, and they will say, you go and report to them, and they are going to assess the disability. And they will, because it is a centralized server is there. So that centralized server, as they give the appointment here, the doctor also get the tell that you have been, this so-and-so patient has been given appointment for you, you have to do the assessment, and that doctor has to do the assessment, and he will upload the certificate to the UDID server. That means you will get a copy. At the same time, it will go to the central server. From the server, within 30 days to 60 days, depending upon the state, a UDID card, that means Unique Disability ID card, will be given to you. And from there, once you get the disability card or the disability certificate, you can take a printout, go to the taluk office, and you have to have a bank account. The amount will be depending upon the state again. Some states will say, we will give you 1,500. Some of the welfare state may say, I would like to give 2,500. So depending upon the state, some state who are very rich, they will give good amount. Some of the state very poor, they may not give, because it is the disability rights is subject to the state financial affordability. So since you are registered in some of whichever state, depending upon that state, they will give the disability pension. That is one. Right. Depending upon, again, if you are a youngster, you want to go and study, there is disability quotas are available for education. Okay, that is 5% is there. If you want to apply for certain jobs, again, certain jobs are notified. It was recently notified that around 1,000 pages, what type of job can be done by different disability has been notified for Class A, Class B, Class C officers. What are the different jobs can be done? Those has been notified. And that even persons with mental illness can apply under reservation for this. That certificate can be utilized. With, again, many of my patients and many of people who are asking whether if I have a permanent disability certificate or even temporary disability certificate, can I ask for reservation? The law does not discriminate between either temporary or permanent. If you have a disability certificate, at that time it is valid, you go and apply. No person, whoever is under the Constitution of India, who is working in the government, cannot reject telling that it is a temporary disability certificate. Nowhere it is in the law, it is written, since you have a temporary disability certificate, I'll reject. You can't do that. If you have any difficulty in that, please approach the disability commissioner in your area. Where is it? Invariably, they will be sitting in the capital of the state, or else even in the district, there are some of the states have made certain people as a disability welfare officers. Approach them, talk to them, and say, these are your difficulties, and say, this has happened. They are there to provide relief. And if you go to the disability commissioner, definitely the case will be heard, and they will make sure the persons with mental illness or a persons with disability, their rights are upheld. And there are various schemes are available again in different states. Imagine if you are from Karnataka, like whenever there is a notification with regard to available of government sites, they will be given. If there are schemes which are being given, it may be certain opening of certain maybe employment. Again, disabled people will be given certain prominence reservation. And if there are schemes for housing, that will be given under disability. So whatever disability schemes are, persons with mental illness will be eligible, but provided they have to get this UDID. So don't waste time. If you are persons with mental illness, talk to your doctor, go to the apply on the online, that is swalamban.gov.in. Go there, apply for that, get your UDID card at the earliest, get your pension, apply for if you're a job, for education. Please utilize that. Over to you, Satyen.
Thank you so much. That's a very detailed and a very useful information which you have shared, Dr. Suresh. I really want to thank you for this. And I think this small segment today of disseminating information and light, to people who need it. And thank you so much, Dr. Suresh, as a mental health legal expert. I think you have more than done justice to the topic, and it will help a lot of people in managing what is otherwise called as a difficult patient, an unmanageable patient, or an uncooperative patient. Thank you so much for your time.
Satyen,
And
Satyen,
yes,
one more point I would like to add.
please.
See, I'm also running on YouTube channel. So I have made those videos available for even Right to Persons with Disability Act, information on Mental Health Care Act. So the YouTube channel is Suresh Bada Math. If you type that, you will get all those videos. So you can visit those. We can visit the channel, subscribe, share, and comment. Thank you, Dr. Satyen.
Absolutely, Dr. Suresh. We'll ensure that the maximum number of people are on your channel and they can take all the benefit from those. Thank you so much for your presence today. Thank you for your wisdom. Have a good day. Bye-bye.
Bye-bye. Good day.
Okay.